stronger as we continue to confront these challenges together. And we recognize that COVID-19 now will be with us for the foreseeable future. It hasn't gone away and it hasn't changed since the very first stay-at-home order was put in place. What we do know now is that as we move forward, things will be different. And as we look to the future, changes will impact how we interact with each other in our neighborhoods, as we conduct business around town, and as we manage daily tasks like going to the grocery store or visiting the library. With an eye on protecting our public health, we are planning for how to make this happen. Public health officials are vital to helping us through this pandemic. By testing, contact tracing, and supporting each case, we're working to prevent further spread of COVID-19. Safety resources, data, reopening plans, and more continue to be emailed and posted by the city. If you haven't done so already, I ask you, please sign up for the city's e-news by visiting our website, www.cityhpil.com, and also follow us on social media. We understand there is a lot of information and some of it can be confusing. The city is working hard to put information you're looking for with appropriate links and summaries in one place. And as a reminder, the city receives data and guidance from the Lake County Health Department and the Illinois Department of Public Health. Due to our proximity to Cook County, we also look at their data. And we're also following Governor Pritzker's Restore Illinois, a public health approach to safely reopen our state. The plan, which can be found on the State of Illinois website and on our website, outlines steps that will need to be achieved to reopen the state and our hometown safely. So for reference, the state is split into healthcare regions. We are in EMS Region 10 in the northeast region of the state. So if you go look at a map, you can see us right there. And the plan explains the data points that we need to reach to move through the varying stages of reopening. While the state as a whole has been considered to be in stage 2, localized data is showing that our curve is not yet flattening. And so it isn't quite clear that we have achieved stage 2. And today, the governor reported that the central and southern regions of the state are all hitting the necessary metrics to move into stage 3 of the plan later this month. But the northeast region, which includes Chicago and the northern suburbs, still is not there. Again, more details can be found on the city's website and in our regular communication. And also, please keep in mind that achieving stage 3, again, is not fully reopening the state. That comes at stage 5. So health and safety measures will continue to be in place for the foreseeable future. Believe me, my council colleagues and I share everyone's frustration and wish for more flexibility. We want to be together again, and we thank you all for your continued hard work. The vast majority of us are social distancing and wearing face coverings as we go about our lives, and we're working together to figure out how to move forward despite this health threat. So thank you for your continued participation, your patience, and your strength. Please continue to follow the orders. If not for yourself, then for our essential workers who have been fighting for us since day one, and for those we love. Together, we will get through this. And I'm now pleased, Geeta, I don't see Mark on the
Yep, he's in.
Spaces. Is he in the waiting room?
Nope, he's with us on the screen.
He's with us. Okay, sorry about that. So I'm pleased to introduce and welcome Mark Feister, who is Executive Director for the Lake County Health Department and Community Health Center. Mark will present highlights of the work they're undertaking in our county and will share specific information pertaining to our community. And I have to tell you, I feel like I know Mark because we are on so many Zoom meetings together while he and his team work so hard to give us important data and help us move forward as communities. So Mark, thanks so much for taking the time tonight to join us. I know how hard you and everybody at Lake County Health are working, and we really appreciate the chance for the public to hear from you and for my council colleagues to hear from you as well. So if you want to jump in, or we can start throwing questions, whatever works best for you.
I'll just do a quick couple of comments, and then any questions, we can do that immediately following. So
Thank you.
Mayor, I just wanted to thank you for inviting me tonight. It is my pleasure tonight to participate in your city council meeting because Highland Park has always been a public health leader in Lake County. And I just wanted to thank this council, as I know many of you members were on it, is that you were the first to pass a tobacco 21 ordinance in Lake County. And just the number of lives that are going to be saved just because of that one action that led to later us passing the tobacco 21 ordinance at the state level is phenomenal. Additionally, your council has moved very quickly and passed the face covering ordinance recently, well before even the governor was able to do that. So I thank you for your continued leadership in public health. And so just as a reminder, as you're all aware that Lake County, we reported our first case on March 11th, 2020. We do believe that we had cases before that. They just were not confirmed. They just were not tested. And as of today, we still have the third highest number of cases in Illinois, next to Chicago and suburban Cook County. We have 5,433 cases and 170 deaths. Unfortunately, 2/3 of our COVID-19 deaths in Lake County are linked to long-term care facilities. And now we have a growing number of our cases are among our vulnerable populations. And when I say vulnerable populations, is that's both in the long-term care facilities, it's also in our developmentally challenged population, but also our African American and our Latinx populations. We're seeing much more growth in those populations with positive cases. Highland Park, you currently have over 165 confirmed positive cases. However, we do know that there are far more cases in Highland Park and in Lake County, as many that have been infected either never knew that they had the disease, as they were asymptomatic, or they didn't have enough symptoms to go get tested, or they didn't have access to testing. And so really, when we look at the amount of people in Lake County that have been tested, only 3% of the Lake County population has been tested as of today, and less than 1% of the Lake County population is tested positive. I can tell you as a public health professional, we know there are far more people out there that either have been positive, just never tested, and there are many more that are carrying the disease that don't know that they're carrying it right now. So they're either asymptomatic or pre-symptomatic. So just as a reminder, Highland Park was actually one of our first hotspots in Lake County, as many of your residents had access to the North Shore Health System, which was one of the best and probably is still one of the top testing facilities in the state of Illinois. And so you had a lot of individuals that were able to access testing when very little testing was available in the state of Illinois. Additionally, many of your residents had either traveled abroad to China or other countries in Europe, or were in contact with somebody that did travel and they came back with COVID-19. So while we now are seeing the spread of COVID-19 beyond Highland Park, Lake Forest, where the epicenter really kind of started, is that it has now moved into other communities north of you. So the majority of the cases that we're seeing are happening along the lakefront. And the reason why that is happening is that's where we have the greatest potential for density. COVID-19 disease is really linked to density. Where you have much higher population density, you're going to have more cases. Areas we have less cases, and where we do have cases, they tend to be in dense and high density areas like long-term care facilities. So it has now moved to the north. We're seeing many, many more cases in Zion, Waukegan, North Chicago. We're having some hot spots in Mundelein, in Round Lake. And so we're really seeing it growing in the Latinx population. So as of today, you've had 938 Highland Park residents that have been tested, and 171 of them were positive. So as the mayor said, is that if you look at the Restore Illinois plan, we want to start having a positivity rate less than 20%. So right now, Highland Park is right about there at 18.2%, but that can fluctuate in any given week. And I'll talk a little bit about that later. But far fewer residents, as an example, were tested just to the north of you in Highwood. And so there was only 181 people tested in Highwood, but 60 of them were positive. So they have a positivity rate of about 33%, almost double your positivity rate just to the south in Highland Park. So the Lake County-wide positivity rate is 26.4%, and we really want it to be below 20%, but ultimately we want it to get below 10 and as low as possible. So for example, in South Korea, their positivity rate is about 3%. So that's where we want to get to, is as low as possible. So I really think that as we move forward is that we need to continue doing what the mayor said. Please continue to stay home when you can. Wash your hands frequently. Keep your social distance of 6 feet from others. Wear your face coverings out in public. And continue to follow the governor's orders and guidelines closely so we don't have a second wave. That's our biggest concern, is we don't want to move into a second wave, and we certainly don't want that second wave to occur during the fall when we're having influenza outbreaks at the same time. So that's something that we're really wanting to make sure that we know the residents of Highland Park. I mean, I'm fed up with COVID-19. I would love for COVID-19 to go away as soon as possible. But as you heard the governor announce today and heard me on the town hall say the other day, is while we're seeing a plateau, we are not yet seeing a decline or a flattening of the curve. We're still seeing about 125 to 150 cases on average per day in Lake County. So we're plateaued, not necessarily flattening or declining at this point. You know, the other aspect is that we're seeing, as additional testing is coming on board, is that we're seeing more positive cases out there that in talking, when we do our contact tracing and talking to people, that they're telling us that they didn't really have any symptoms. They didn't really know it, but they were exposed to somebody they knew had COVID-19. So these are carriers of COVID-19 that are walking around that may be exposing other individuals. So we can't let our guard down. I know I have a lot of empathy for many of our Lake County residents that, you know, are out of work. They don't know how they're going to pay their bills. They want the economy to come back quickly. We all do, but again, at what impact is that going to have on the rest of the county if we were to open up things very quickly? So we want to make sure that we do things scientifically and not move in a way that we may cause a second wave. So with that, Mayor, I just want to say thank you to all your Highland Park residents for everything that they've been doing, the sacrifices that they've made. That again, this has been a challenging, you know, since February, March, it's been very challenging for us. There's been information that was not provided to the United States from other countries about how infectious this is and how easily this can move from one area to another very quickly. So I'll be happy to take any questions.
Thanks. I have 3 questions and then happy to hear from the council as well. You know, you mentioned the lakefront. We just opened paths down to the beach and up again with the hope that people won't congregate on the beaches. But questions are raised in terms of recreation and specifically the flow behind people when they're running or if they're walking. People are wondering if we should be saying more about that or if it's less of a risk than people think. I'm looking for some guidance in terms of how to calm people down or some data to give them a better sense of what their real risks are.
Yeah, I think the majority of risks are when you're within that 6-foot window, because this
Right.
is a respiratory illness, and so it's spread by droplets or vapor that comes from people talking or coughing or sneezing. So that's why the other thing is we want everybody to, you know, not be out if you're coughing, not be out if you're sneezing, and certainly if you're walking, you know, you should wear a mask. If you're running, that's a little bit harder, but runners should be, you know, I run, and so every time I approach somebody from behind, you know, I always make sure that I'm, you know, 6 feet away from them and that I don't cut in front of them right away. But really, you know, that's a very limited interaction, and so really there should be very little to no spread potential at all from that type of interaction. So usually when we say that you're having a meaningful interaction, that you're with somebody, you know, within that 6 foot, you know, for an extended period of time. So that type of interaction should be fine, but really it's just making sure, and I know, you know, we have proms and we have graduation, But, I see in my own neighborhoods is that, people are starting to have garage parties, as I call them. And I see people sitting right next to each other. And so they just spread those chairs out 6 feet or more. And that way, we can better protect ourselves.
So along the same vein, we're looking tonight or discussing whether tennis should be open. People want to play catch in the park. Is that also a risk situation, or I mean, obviously everything in this world, there's a little bit of risk. Case in point, Adam Stolberg's eye. But I just think we want to talk about, how much of a risk is related to people playing tennis or throwing a ball in a park. Is that something that we should still be not so quick to move towards?
Well, again, I think this goes back to hand washing. I mean, with tennis, that you're going to have, two individuals. I mean, I wouldn't recommend doubles. I mean, that's situations where you're putting, team members on the same side. It's tough to social distance there. That you're touching a ball, you're hitting that ball. I mean, as long as people, are just aware that they're not touching their face and they're washing their hands after playing a sport like that or throwing around a ball, again, there's always some risk, as you say, Mayor, but the potential of that risk is lower. It's really that social distancing and that hand washing that's gonna help protect people.
And then my last question goes to capacity to treat. And my ears always perk up when the governor talks about the different regions. And I mentioned earlier, we're in Region 10. And I know I asked you this question when we were on the Zoom call last week. But in terms of what's available and ICU beds and ventilators, I know the Northeast portion of the state is probably pushing things the farthest at the moment. And didn't know if you've seen any easing off, or are we still kind of in a high use capacity given how many cases we have?
Well, that's a very good question, Mayor. And so we're rates. That's one of the metrics that we're using to move from one phase to another. So while our positivity rate in Highland Park may be below that 20%, is that if we look at our hospital systems, especially the ones that serve Lake County, is that our ICUs are still very challenged. Is that we are well in excess of the licensed beds for ICUs, and so the hospitals have expanded their ability to serve people in ICUs, having beds outside that ICU. But from what I'm hearing from our hospital presidents, we have a weekly call, is that it's plateaued. They're still having the same number of cases week in, week out, and in some cases we're seeing some spikes. And so, like North Shore System, they have their COVID hospital, their main COVID-19 hospital is Glenbrook. But if I look at Lake Forest, and I look at Condell, I look at Vista East up in Waukegan, all of those ICUs are tracking almost the exact same way. So it is plateaued and continues to have some spikes on a daily basis. They've been able to handle it, but we're not seeing a reduction yet in ICU use in Lake County.
And so truly we need to keep wearing masks and social distancing and staying at home as much as possible. This isn't a success. This is a sort of a static ground, but we haven't gotten out of the woods by any stretch, it sounds like.
No, we're again, I like using the word plateau, but we do have spikes within that plateau. And I think the other factor here is that, so while we're in the Northeastern region, some people may not like us to be connected to Chicago and also to Cook County. But if you look at the metrics for ICUs or bed use or ventilators, is that all of the Chicago region that we're in this Northeast region counts all the additional capacity that's available for our residents if it was needed to transfer to other hospitals. Right. So actually, those metrics may actually help us by being in the Northeastern, whereas the positivity rate, we're really seeing, vulnerable populations like Waukegan, as an example, has a positivity rate right now of 55%. So that's one of the highest positivity rates that we have in Lake County. And some of the other communities that I mentioned, Mundelein and others are like at 30%. So we still have a ways to go in some of those communities, but we're also having more and more issues with, younger people that are having to go to the ICUs. And I think that's something too, is that while the majority of our deaths are happening in populations greater than 60 years of age, is that it's not, the younger individuals are still having to be hospitalized or go to the ICU because we have many younger people that have diabetes, they have other comorbidities like cardiovascular disease, high blood pressure, and obesity. And what we're finding is that Americans are tending to be more susceptible to COVID-19 because of those other risk factors.
And we know also in looking at the Cook County data that it nets out Chicago and Evanston, I believe Skokie, Oak Park, they all have their own health departments. So the data actually is a lot closer to our demographic, I think, than people realize. For me, it's just interesting to see where Glencoe and Glenview and Northbrook are as well. A few council members have some questions. I saw Councilman Noble and Councilwoman Stone. Councilman Noble, do you want to start?
She's muted.
Thank you. I was muted, sorry. And I think you've got everybody's hand up because I saw Councilman Holloman as well.
Okay.
Thank you, Mark, for doing this. You've been fantastic leading, so I appreciate it and I appreciate being with us. We've been watching you from afar, and thanks for working with everybody. I have 3 questions. They're all kind of unrelated. I can ask them all at once if you'd like, or go back and repeat. The first one is about younger children. There's a concern, I'm starting to get questions about, there are young children who have gone into the ICU. One died. We've seen it in New York. We are hearing about it here in Chicago. Could you talk about the protocol? Like, everyone has been told, don't walk into an emergency room if you think you have it. Can you give the public or residents some tips on what do you do if you suspect your child might have symptoms? Because I know they're not exactly like COVID. They just share that fever as a common denominator. The second question I have is, if you could also explain those who have been tested and have the antibody, can you just reiterate what we have all been told is it doesn't mean you're immune and you can walk about and do whatever you want because you won't infect anybody. And then my third question has to do with contact tracing. What is our plan? How does it work in Lake County? And I understand there's a need for hiring. We've got a lot of teenagers and college students who would love to participate in that. What's the age? And how do they go about doing that?
All great questions. And I think for the first one, I mean, we're learning more and more about, some potential, diseases that may be impacted or related to COVID-19 in children. And so what I always say is always start with your provider. And I think this is where, have that conversation with the provider, talk to that provider about the symptoms, and then, working with the provider, then you can make a determination, if you want to be, if they need to go into the emergency room. I do know that our hospitals are doing everything possible to try and triage and make sure that individuals that have COVID-19, are not going to be interacting with other people that are there. But again, this is a very challenging, very, very challenging bug. I'll just say that is that, it's sometimes when people are tested on one day, they may be negative, but they may be exposed 3 days later, and then they test positive 3 days later after that. So I think there's still a lot that we have to learn about the connection between children and some of the other diseases that you're reading about in the paper. But I would always start with the provider and really assure that is this a needed visit to the ER. We are seeing a little bit of uptick with the nice weather of just other common injuries, and I do know though the hospitals are really trying to separate out those types of injuries from the other people that they know are positive with COVID-19. So more on that. To your second question is that yes, there's unfortunately the FDA did not approve. They opened up a waiver so that a lot of these antibody tests. So these are the blood tests to determine antibodies. A lot of these tests have really not gone through any rigorous testing. And so there's a lot of tests that are out there that really don't have a lot of value. So I just want to make sure that the Highland Park public understands that some of these tests, have very high false positives. They have very high false negatives. Their accuracy has really not been determined well. And so in some cases, it's buyer beware. You know, if you get tested for this, is that you may come back negative, but maybe you were really positive, or maybe you came back positive, but really you're negative. And so these are situations where, you know, FDA is taking a closer look at these antibody tests or serum, taking blood tests. And the other problem is that depending on when you test, is that there's a couple of different antibodies that we're looking for. So IgG, IgA, IgM. And so when those antibodies show up are in different times. So if you had a certain test that was testing for one of those antibodies, but that antibody doesn't really show up at the time you're being tested, but shows up later or showed up before, then you may not test positive, even though you may have had that antibody or later on had that antibody just by when that testing was done. And then I think the big thing, you said it very well, is that we don't know if people really have immunity. We don't know how long that immunity is conferred for. And so, yeah, for people just to get a positive test and they say, I have antibodies, and then they don't wear a mask or they don't social distance, you know, they could be putting themselves into a situation where maybe they never had it and never really developed those any immunity at all. So that's an excellent point. So at this point in time, we're really not recommending that people are doing that antibody test. And a lot of our hospitals that are doing an antibody test are also doing a test at the same time to verify it with a PCR or a nasal test, just to confirm that they have genomic material, you know, in their nasal passages. And then
you had one other question about kids helping with contact tracing.
Yes, and so contact tracing. So the governor put out that and we have a new epidemiologist that came to us from CDC that's looking at a new methodology, an expanded methodology of contact tracing. It may include additional new types of software, but our new epidemiologist is even saying that the soft rollout probably will not happen until the end of the month. There's a lot of work that has to be done. But what we're currently doing on the new model, there's work that has to be done. On the old model, is what happens is that our staff, once we find out that there's a positive test, our contact tracers are calling that individual. They're asking that individual, you know, what were their symptoms? When did they start? Did they have a travel history? You know, where do they work? Where were they exposed? You know, and about others in the home that may have been exposed. And so those are all questions that we're asking. And then what happens is then we get all those individuals, we contact them, ask them questions, same questions, ask them about symptoms or other issues. And so then the whole process starts. So in some cases, like early on, you know, when we had the first cases, some of our contact tracers are talking to 100 people as an example. It's amazing how many people that individuals come in contact with very readily. So with regard to hiring, you know, the state is still working on that model. One of the things that we have to do is that while it would be nice just to say that we're going to hire students, hired retired people, they can work out of their home and do contact tracing. Unfortunately, the system that all this data is in, it's a protected system. It has to be a secure system because it contains medical information and all kinds of medical information. It contains all kinds of information that is PHI, as we call it. And so personal information such as date of birth, all kinds of addresses. So that's one big thing, is that before we can really do that, is right now all our contact tracers are coming into our office. They're working out of our system, so we know it's secure and that all the information is staying within our system. Pushing that out to computers that are on unknown internet connections, pushing that out to unknown phones, that's going to be more of a challenge to make sure that doing it from home and having our contact tracers not coming into our offices is going to be a little bit more challenging to make sure that we secure that information.
Great. So now we'll go to Councilwoman Stone and then Councilman Holloman.
Thanks. Thank you, Mark, for all that you're doing. Gita may or may not have told you that I've actually been keeping track of the data that you've been sending each day from the health department and graphing that. And I shared with her today that I was concerned by what you've told us again tonight, that the cases seem to be sort of stalled. And while we've plateaued, we don't seem to be decreasing. Is there anything that we could be doing differently to start to see those cases go down? And then I've got a second question as well, which is a follow-up to Councilman Noble's previous question about contact tracing. How do you do any of that if you have a patient who's seriously ill and perhaps intubated?
Great, both great questions. And so on the first one is that, yes, and I actually, Gita showed me your spreadsheet, and I thought you copied mine. It was almost column per column like what I do. And so one of the things that I did want to say is that if you're playing at home and watching the number of cases daily, is that one of the issues, and this is what we could do better if we lived in a perfect world, if all the laboratories reported into one system at one time, so when they got tested, that information went in, we would know exactly when people were being tested, and then when their results were ready. Unfortunately, our system in America is very fragmented, and so you'll see some variability on a day-by-day basis because the systems that the labs are reporting from, some labs like North Shore, they're pushing out data within 24 to 48 hours every day, day in, day out. The state lab, sometimes it takes between 3 and 5 days for the results to come out. Some labs that are commercial labs, they may be able in 1 week to be pushing out data every 24 to 48 hours, but there's been times that some of these labs have taken over a week to 10 days to 14 days for that data to be pushed out. So what you're seeing is when the state receives that data, so if a lab was to push out 14 days of data, we're seeing a big spike on that day. It's not really reflective that all those people tested on that day were tested positive. What it's reflecting is that when the data was reported. So that's why you'll see big jumps between a day of 200 plus cases in Lake County, and then it drops down to 85 or 86. That's more of a factor of reporting and not necessarily of individuals that were positive on that day. So that's one of the problems with that. And then your question on contact tracing is, can you say that again?
Well, let me go back to the first question though. Is there anything we could be doing differently? I understand that there's some differences in terms of the timing, but still the total number seems to be sort of.
Yeah, so actually one of the things that we're really trying to do is to limit the increases, is that where we're finding the greatest number of additional cases are in individuals that were our essential workers. And so where they're being exposed now is at work. And so that's why the health department is really working with municipalities, it's working with the companies to make sure that they are appropriately social distancing when they know that they've had a COVID-19 case in their facility, that they're doing extra cleaning, that they're keeping that area off limits until that cleaning is done, especially not opening it to the public, making sure that their staff are wearing masks and trying to do as much as possible to get them social distance. We've also had, corporations and other entities that still had, their lunchrooms open. So we had people sitting side by side. So while they were doing a good job out on the floor, they were all eating lunch together. So figuring out new and better ways, to reduce the potential for infection to be transferred from one individual to another. And we're also finding too, is like working with temporary agencies, some of these essential workers are being put in a van or in a bus. And so, this is another problem is that, they should be spacing them out on the bus. They should be using more vans, moving them and then having them masked while they're in that van. So those are the things that we're trying to reduce that rate. And what was your last question on contact tracing?
The other question was how you do contact tracing with somebody who is seriously ill, perhaps intubated.
Yes, so that's another great question, is that we'll be working with family members as much as possible. So while they can't talk, we'll talk to the family members, find out where they worked, who their friends were, what family gatherings, were they, we had situations as an example where people had, gone to a fundraiser. And so we had outbreaks there. We had people that had gone to, a revival. So we talked to the families And then we do the same type of contact tracing as once they tell us who they may have been in contact with, then we obviously talk to those people. While it's not perfect, because ultimately not everybody in the family knows where mom, dad, sister, brother were at all times, we do find that it's been very relevant to find out information about where they were potentially exposed.
Great. Thank you. Councilman Holloman.
Thank you so much. And Mark, thank you again, as everybody has, for the work that you do. We truly appreciate it and understand these are extraordinary times. I just wondered if you could address or share some additional information about congregate living facilities. Highland Park has several senior care facilities, and we just saw an explosion in cases in Highwood as well. Can you just talk? I know the county has taken a proactive role in working with these organizations and facilities. Could you just talk a little bit about your role and what you're doing to try and contain, and if you're doing any special testing at those facilities where folks are not able to access or leave to go to Waukegan or other facilities?
Yeah, I mean, definitely this is, something that I've been talking about for the last 4 or 5 plus weeks, is that, readily we figured out that congregate settings were our biggest source of potential transmission of this disease after the governor's order. I mean, once the governor put out his executive order for the stay at home, I mean, yes, there are people that don't follow it, but I have to say, for the most part, that I'm very proud of our Lake County residents and your Highland Park residents for staying at home, and they've really only gone out for essential functions. I mean, when our Lake County sheriff gets calls about individuals that are doing certain things, as soon as the Lake County sheriff shows up, if there was a congregate setting that they're disbanding, they're moving, with no problem. And so, we've had a lot of great cooperation from our public. However, in long-term care facilities, it's a major challenge. You have individuals, that's where they live, and there's really no place for them to go. They need care, they need help. They're vulnerable, that's why they're there. They need assisted living, they need, special care. One of the big issues that we readily saw is that a lot of the staff that work at long-term care facilities, no fault of their own, but the pay is not so great. And so they tend to work not at one facility, but they work at several facilities. So a lot of times in the beginning, a lot of the cases that we found were actually not resident cases, but they were staff cases. And so, those staff were working with different individuals. Some of these facilities were more prepared, having the appropriate PPE. Some of these facilities were more prepared with their infection control procedures and policies. And so, depending on which facility was at, is that we still have, luckily in Lake County, many facilities that have 0 positive cases either in staff or in their residents at this point in time. So that's lucky. But, we're tracking over 40 different facilities in Lake County. And when I say tracking, we have an assigned person that is working with those facilities, talking to them sometimes daily, sometimes multiple times per day. We've been pushing out thousands. We hit over 1 million mark of pushing out PPE to both long-term care facilities as well as first responders. And so we've been trying to get them the appropriate PPE. We've been training them how to appropriately don and doff, the PPE, because that's the other thing that we have found, is that individuals that work in these facilities, is that, I was out doing an inspection on one of the facilities 2 weeks ago. And so I just sat there and observed, and I saw men, as an example, wearing N95 masks, but they had beards on. And so an N95 mask does not work well with beards. In fact, OSHA does not even allow you to be fit tested for that N95. So the value of that N95 mask is limited because that individual had facial hair. So that was something that I talked to the administrator about, to say, if they're going to wear N95 masks, then they need to be clean shaven. You can't have a beard. Or, situations where, when you go into disinfection procedures, is that you can tell just by smelling, how strong a bleach solution is, or as an example. But if we're not smelling a real strong bleach solution, those are situations where we're talking to the long-term care facilities and saying, well, what is the concentration of your bleach solution? How are you testing it? How are you making that bleach solution? And in some cases, Some people did a really good job and they had, test strips and they were able to say what the chlorine concentration was. Other locations, they didn't have those test strips and they didn't know what it was. Or again, situations where, did they have hand sanitizer at every station? Was there hand sanitizer missing? In some cases there was. So we've really been pushing long-term care facilities to, wear the appropriate PPE, wear it well, know how to don and doff it, also to have great infection control and to use the appropriate sterilization and disinfection. And so when they started doing that, we started seeing some of the cases, be reduced. To your question on testing is that, what we're really pushing for is that IDPH, has made a commitment to test all of long-term care facilities. And so they are starting to push out tests, but they're only pushing those tests out for staff. We actually are recommending and wanting the state to push out testing for all staff and all residents, because when we've tested, facilities for both staff and residents, there have been some asymptomatic positive COVID cases living there, but they were asymptomatic. So we want to make sure that anybody who is positive, that we're separating them out, putting the positive cases in a wing and keeping the non-positive cases in another wing, if at all possible, depending on, how that long-term care facility is set up. So we're strongly recommending that. So I do have a couple of different entities now in Lake County that are doing additional testing. Is that if or have laboratory capability to do testing. So if we aren't getting what we want from IDPH, I'm going to start working with those entities that have laboratories. And then that way we can get the facilities test kits to do that testing. And we also don't want this to be a one and done, because that's the other problem too, is that this is a point in time test. You can be negative one day and a week later you can be positive. So, I mean, just look at the different elected officials that you've heard about that are being tested on a daily basis. So great question. So yes, that's definitely a focus, all congregate settings. So it's not just for long-term care. We're also looking at congregate settings like our jail, Lake County Jail. We're looking at and working with different entities that have behavioral health treatment, for individuals that are suffering from opioid addictions. We're working with them, and we're working with, entities that have people in their facilities with developmental delays or other issues that require them to be in a congregate setting.
Thank you.
Thank you.
I know Councilman Noble had one more question, and then Councilman Kaufman, I see you. Thank you. Councilman Noble and Councilman Bloomberg, I'll catch you after Councilman Kaufman. Councilman Noble, go ahead.
Thank you. And I promise this is my last one. There is something coming out of, I think, Belgium about pods, quarantining, or your social bubble. I've gotten a few questions about it from residents like, I'm ready to expand my bubble because I'm going insane. My mental health needs it. Can you give me directions how to work out my bubbling? I don't know if you've heard about this, and you're smiling, so you probably have. I've even seen there's a hashtag quarantining, and people are showing how they're now with another family. I assume you don't advise that people should do this or allowing their kids, because they live across the street from each other, to play together. But I'm curious for the public if you could give your opinion and suggestion about this.
Yeah, and again, I think this is where, the governor, going back to his orders, is that, right now we're at, trying to minimize, bubbling within, 10 or less individuals, and even that 10 or less individuals. I think the problem with all of this is especially with kids, and even like dog parks. I've talked to Ty, my counterpart, the executive director of the Lake County Forest Preserve District, and once you start bringing activities or things together, I mean, humans just like to congregate. I mean, we like to be near each other and touch each other and do things together. I mean, especially kids, is that, just look at any high school students, is that they tend to have their hands in the other kids' hair. They're always next to each other. And so it's a challenge to keep people appropriately social distance in any type of, bubbling. And so again, even if those individuals get tested and so they're more certain than not that, nobody in that group has COVID-19, is that we're still going out to grocery stores. We're still going out to, other areas where we may be exposed and, that you may come in contact with somebody. So, it's an interesting idea. I think, again, it's just like even in our emergency operations center, I mean, when the governor's order came out, I mean, we've been diligent about making sure that we never have any more than 10 people in that room. They're all socially displaced or from one another. We're walking through our hallways. We're masked. We're trying to maintain that social distancing. We're just really taking it very seriously to make sure that we're not having people in close proximity to each other. Did that answer your
Thank you.
question?
Yes,
Councilman,
thank you.
Thank you, Mayor. Mark, thank you so much, and we can't thank you enough. So for everything you're doing, but what's the best projection at this point in Lake County for when you might anticipate seeing a flattening or decline? I know there's so many variables and it's hard to predict.
Well, I think we're in the right direction. I mean, I think opening up the community-based testing facility, it's free testing. We're doing 750 tests per day. So this is, everybody from the worried well. It's I think it's also too is that with people that have undocumented or issues with their immigration status, is that they can come there. There's no major questions about that. I think a lot of our cases that haven't been tested, we're fearful of even coming to my federally qualified health centers, even the one down in Highland Park, just because they had some concerns about, would that information be shared and would it have some negative consequences for doing that. So having the drive-through testing now in Lake County, we do know that every day that we're testing at least 750 people, but we do want more people to come to it. And just so everybody knows is that the testing facility really gets jammed in the morning, and this is just human nature. I mean, whether we do rabies vaccination clinics or flu clinics, that it seems like people always want to line up early in the morning. But by 11 o'clock in the morning is that there's hardly any line and people can get right through, and they still have tests for the rest of the day. So, if we can tell people just to delay, they don't have to wait in line, there will be tests. So if they can show up a little bit later in the morning, then they may have a lower waiting time for that. So the more testing that we do, what I'm really hoping to see is that the positivity rate continues to decline, which means that more people are being tested, but they're negative. And so, I'm hopeful by the end of May that we're going to have a better idea of what our situation is and actually starting to see a decline in both the number of total cases that are new cases or incidents that's happening every day, but also a reduction in the positivity rate. Because again, I would really like to see us get well below 10% and try and aspire to what South Korea has been able to do.
and I know that today in his news conference, the governor stated he didn't see any real flattening until mid-June, which is probably not what people want to hear, but
Yeah, and again, I think the governor, as we test more people, we're going to find more people, because just going back to where I started, I mean, only 3% of the entire Lake County population has been tested as of today.
right.
So, I mean, that's 97% of our population that either A, doesn't know that they have the disease, or that they have the disease, or that they don't have the disease.
Right. Councilman Bloomberg.
Thank you. Thank you very much for being here. This has been extremely helpful and educational in many respects. It seems to me that the greatest element of communication of the disease is both the potential to be communicated by air droplets, but primarily through contact. And what we're trying to do in the various aspects of social distancing and the other limitations as a government entity that we're trying to keep in place are to reduce points of contact. One of the things, for instance, I've identified that people don't seem to understand is that a lot of things can be a point of contact that aren't recognized, like dogs. Dogs don't necessarily carry the disease, but if somebody pets a dog and then somebody else pets the dog, that's a point of contact. So there are a lot of issues regarding contact that it seems to me we're trying to avoid. Could you address that a little bit?
Yeah, I mean, I think there's different, we try and talk about, what surfaces are more apt to provide, COVID-19 virus that would be meaningful to infect somebody. And so certain surfaces, impervious surfaces the COVID-19 may not last as long. It's easier to clean, it's easier to disinfect. But to your point is that, if I have COVID-19 and I'm kissing my dog and I'm hugging my dog and I'm spreading, and then my family member then goes and, the dog licks that person's face, that's a potential for transmission. So yeah, we definitely tell people to not get in contact with their pets, pet them. But again, hand washing every time you have, any interaction with your pet, that you should be washing your hands.
Well, and it may not just be the owner, but like a park bench, strangers, people who are strangers to each other come in contact with a park bench or a dog in a park, and that operates as an opportunity to communicate the disease. A very discrete and specific question that comes to my mind, you were talking about the use of the N95 mask in the healthcare setting, where the mask is being primarily used to protect the wearer from acquiring the disease. But I wear a beard and I mask, and I mask principally because I want to make sure if I have the disease, I'm not going to communicate it. As somebody with a beard, and I know plenty of other people with beards, is the use of a mask in the public setting for the purposes that we're wearing a mask for something that is still reasonably effective for us?
Yeah, so the only purpose of wearing an N95 mask is that if you're in direct contact with patients, really that have known COVID-19 or may have known COVID-19, because that's just giving you, the N95 mask is that any type of mask you're wearing, we actually have your EMS personnel, we have law enforcement, they get fit tested so they know that mask, so when they're talking, when they're bending over, that mask is keeping a nice seal around their face. Some masks work better than others. So if you have a beard, then if you only had a mustache, then that would be fine. But we're really looking for that around here. But what we do say for the face coverings for your general use, as long as they're tight to your face, around your nose, that will be sufficient. If you were to cough or if you were speaking and you had it, that should block the droplets or the vapors from going off to somebody else. So yes, that's the originally, I think CDC, did not want to really push face masks because there was such a limited number of PPE. And as you remember, I don't know what it is with the American public, but we had a run on toilet paper, as if we were not going to have, COVID-19. So while we do know that some people have diarrhea, I mean, just the vast amount of toilet paper that was hoarded during that time frame. So I think that the original worry from CDC was that people were going to go out and start hoarding, PPE that was well needed for healthcare, first responders, and other essential workers that needed that direct contact. But yes, face coverings will work as long as they're tight to the face. Then that'll be great. And then anytime you wear them, I mean, they should be washed frequently. And then when you take them off, you should be taking them off from the back, not touching it. I think the face coverings, what they really do, the best thing that they do really for us is that, there's been studies that show that you touch your face, 23 times every minute. And when you have that face covering, it reminds you not to touch your face. And you've all been doing a great job. I've been watching you not touch your face. So excellent job.
I've had a little help.
Thank you. Any other questions for Mark Pfister from Lake County Health? Can't thank you enough. All your hard work day in and day out and joining us this evening. It's really been so greatly appreciated. So thank you. Thank you.
No, and I just want to thank you all again and for all the work that you're doing to spread the information. Again, Highland Park, you've always been a public health leader. So I just can't thank you enough for everything that you're doing. And I got to tell you, you got one of the greatest city managers around. So she's somebody to keep. So thank you very much.
To good health. Thank you.
Yes.
So that was
you.
the perfect segue for me to invite City Manager Newkirk to provide a brief COVID report with specific emphasis on the city's services response, as well as coordination with community partners like Lake County Health and so many others.
Great. Thank you, Mayor. And I just want to make sure Councilman Holloman is back on. I saw that she had logged off just very briefly and then she answered.
I'll text her and see where she is, and if you want to
Okay, perfect.
start on.
All right, I'm going
Thanks.
to share my screen and hopefully this will work.
And I'm going to log off. So thank you, everybody. Have a nice night.
Thank you so much, Mark. Take care. I saw Councilman Holloman re-logging on.
Okay.
There
just
she
want-
is.
I have two screens going, so you can see the screen with the presentation. Right?
Yes.
Okay, perfect. Okay, so Mayor, thank you so much. We will have this PowerPoint presentation on the city's website if anyone wants to reference it in the future. And this highlights of this meeting are also going to be communicated. And we do have this meeting right now being replayed on Facebook or played live on Facebook. But this is the information I just want to cover briefly for our staff report. I do just want to lead off first and just thank you, Mayor, so much for your leadership, as all the city council members. The amount of time that you are spending, dedicating your time and effort and hard work to managing this pandemic, providing sound policy, really on the basis of public health and safety is really outstanding. So thank you so much for your time. I do want to also recognize our senior staff members. All of our department directors are on this call as well. They have been working tirelessly. You know, we say that every day is a weekday. You know, we're working 15-hour days, but the collaboration that everyone has is really exemplary, coordinating, managing their departments, making sure that our employees are healthy, as well as certainly serving the public. And particular thanks to our first responders. As everyone knows, I mean, they are on the front lines doing what they love, but doing it in a very uncertain environment and a scary environment, certainly for their loved ones. But they take pride in what they do, and they do it very, very well. And the community support throughout has been outstanding. So we just want to thank everyone for continuing to follow the rules and the policies that we are sharing, continuing to stay in communication with us, and for all the support that they're providing to not only our essential workers, but all essential workers in the community. So this slide may look familiar. Our first public presentation to the City Council was made on March 9th. And even before March 9th, when we were first discussing the coronavirus or COVID-19, really before that, we were reviewing our emergency operations plan and making sure that we had necessary supplies, just in anticipation based on guidance that we were getting from state and federal agencies that this pandemic was coming to the United States and particularly coming to our area. So this is just a snapshot of all of our partner agencies. We are in daily communication with the governor's office, with our local government partners, with neighboring communities, all the state and federal agencies that you see here. Certainly, as the council is well aware, we don't have a health department, so we rely on the county health department for their expertise, and all the decisions that we are either making as a city or amplifying from the state of Illinois are really based on this health information for the protection of public health and welfare. On a weekly basis, we are having formal meetings with not only the government serving Highland Park, but also of our neighboring communities. The governor's office has special briefings for municipalities that the mayor and I are participating in, and there are numerous other video conferencing and meetings and information being relayed. And so at the onset, what we were doing is taking all that information, and we really wanted to create kind of a one-stop shop on our website to make sure that people have all the information that they need to protect their family and their friends, and to provide information for their businesses. So we're going to continue to reinforce and encourage people to go to our website for that information. You know, we are we are sharing information on behalf of other units of government, but I do want to stress to the public that we don't oversee other units of government. So there is some confusion when we talk about, for example, our partnership and collaboration with the Park District. We are not setting the rules and regulations, for example, for the Park District. We're not setting the rules and regulations for the school districts. The governor's office recently indicated in one of the orders that school districts can go into, can set up times for their students to come in based on a safe procedure to maintain physical distancing. So those students can get the information, get their supplies from their lockers. So the school districts are coordinating with us because they want to share with us those plans. We are looking at it from a traffic management, from a safety perspective, but ultimately it's up to that respective jurisdiction. Similarly, we're coordinating closely with the Park District as they are putting together plans and policies pertaining to their respective operation. We're in close coordination with them because we're looking at it from a public safety perspective as it relates to law enforcement or our fire department most specifically. So this is just a snapshot of the key emergency orders that were advanced by either the state of Illinois or our local orders, which were set forth by the mayor with consent of the council. So the very first one was on March 9th, and you can see highlights of most of them that followed thereafter. For the most part, the city of Highland Park is coordinating with the governor's office. And so we have been very careful and I think have taken a very astute approach to making sure that we don't have unique policies and procedures that are separate from other jurisdictions. Because candidly, when people come into our town, they may not know what Highland Park has that's different from Deerfield or Highwood. And so again, that's the importance of making sure that we are aligned with our neighboring communities and really following based at the direction of the state of Illinois. Now, I'll tell you, in Highland Park fashion, we have been leaders in several areas. The CDC recommended that individuals wear face coverings for the best protection to help minimize the spread of the virus. And so Highland Park was one of the first communities to advance a face covering order. And so we did that, as you can see, on April 17th. We had followed the village of Glenview, who had done that a couple of days before, but then soon thereafter, our neighboring communities all around us all passed the face covering order. And then the state of Illinois passed it for the entire state on April 30th. So all these orders are available on our website with exact details, and we're providing highlights of each one as well. So people often ask us, why is this important? What exactly are the numbers? So this is really just a snapshot of the importance of this virus. And what you'll find if you individuals go to the Lake County Data Hub website is you'll be able to see the trending of how quickly this virus is spreading if we do not follow these protective procedures that have been put in place. So these numbers are updated every day. We get them from either Lake County or the state of Illinois, and both are all sharing information. And then the map that you see there highlights all the municipalities in Lake County. This is on the Lake County website. So again, this too is updated every day. And it's based on the cases based on an average of 10,000 population. So as you can see here, the numbers are significant. We are paying very careful heed to our long-term care facilities, so our senior facility, assisted living facilities, anywhere where there's congregate care. So just as a follow-up to Councilman Holloman's question a little bit earlier, I think the Lake County Health Department has really been doing an outstanding job, and as cases are taking place at these long-term care facilities for either the patient, the resident, or a staff member, Lake County is certainly aware of that. They're providing guidance to the facilities. They're working with them very carefully just to help make sure that that the COVID cases don't increase at that facility. And from a city, we are in daily communication as well with these congregate care facilities. At the onset, we were providing them face coverings when they needed it. We're helping them with guidance, really any resources that they need. So as it pertains to just kind of managing the city in the pandemic, as I indicated, we are in daily communication, certainly as a city staff. You'll see those mug shots that you see there on the screen. So we have regular conference calls, Zoom meetings with all of our staff just to make sure that we're all in sync in terms of our policies, our plans, our procedures. We are following emergency operations plan to make sure that we have efficiencies and effective procedures put in place. So one example is we have Joe O'Neill under Ramesh's leadership is serving as our supply coordinator. So there's one person in the organization that's managing all the supplies the departments are using, how quickly the burn rates are, specifically for police and fire personnel. When there's an order opportunity for additional supplies, it's going through that Joe as our point of contact. And that's helping really to create great efficiencies in our organization rather than having silos among all the departments. We are getting questions, are you open? And so we're not open where individuals can come walk into any of our public buildings, but we certainly are working. Most of our employees are working remotely, the administrative positions, but we are conducting inspections. Very often we're doing those via teleconference. We are processing vital records. We are overseeing public works and infrastructure work. And so as much as we can do online, we are doing it. And so again, if individuals have questions, they can contact any of our departments online and we will respond as soon as possible. And of course, we're doing a significant amount of education on the state's orders as well as any local orders as they're advanced and then regularly throughout. And then as it pertains to emergency preparedness, we, on a daily basis, we are regularly taking all efforts to make sure that our employees remain safe and that they are providing the best possible care to the public. So you can see there, the picture on the right side is a decontamination process for 2 of our firefighters. So when they do come in contact with a COVID patient or someone who's believed to have COVID symptoms, they're coming back to the station and they're going through a full decontamination before they step into the building. And so that's to help ensure that the virus stays out of the buildings, helping to ensure that our employees are safe as they provide service to the public. And then the police side, as you can imagine, we're responding to a lot of calls and inquiries. They're still doing everything that they do so incredibly well in terms of providing public safety and education to the public. And they too are equipped, making sure that they're wearing gloves, making sure that they have personal protective equipment on as well with all contacts to the public. We've talked in the past about our coordination with public safety dispatch. So our dispatchers are continuing to ask questions of individuals that contact 911 just to make sure we are best prepared before we go to an emergency scene. And there's significant coordination with Highland Park Hospital on a regular basis as well. And then just as a reminder to the public, our water treatment plant, our employees are doing everything possible to keep themselves healthy. We have changed our staffing levels also at the water treatment plant just to make sure that we've got physical distancing set in place. And in the event that someone does have the virus, that we have backup plans to ensure that the water plant operations will continue to provide service not only for Highland Park customers, but all of our water customers as well. Mayor, you touched on the communication. So just very briefly, this is the city's website where people can see the wealth of information, not only for the city, but also for our partner agencies. And we have issued 34 electronic newsletters. Those are issued every Tuesday and Friday and more frequently as appropriate. We've issued more than 11 media releases, I think 12 media releases now since the onset of the pandemic. And we are updating our website daily. We're also posting on social media daily. Councilman Stolberg had asked a question at our last meeting. I followed up with the council based on information that Amanda, our communications manager, had shared about the number of hits to our website. So we certainly have seen an increase in the amount of views and the amount of people liking us on Facebook and following us on social media. We've had a total of about 128,000 page views to our website for the period March 1 through April 30th. which is an increase of 57% from the previous period. We are monitoring all the pages that people are going to. And so most often people are going to our restaurant pages, which is great. We want people to shop local. And so they're finding out, hey, who's delivering? Where can I eat? And so that's wonderful. We want to continue to encourage that. Our face covering information is also one of the top hits of people finding out what are the face covering requirements, where can I get a face covering, how do I make one. Our community resource page, donations page, and the press releases. So we're continuing to monitor that and making sure that we've got all answers to questions that people have in that regard. So this is also just a highlight of information that is available on our website. We have frequently asked questions, which are updated on a regular basis, so people can find out what exactly this virus is, where they can get other information. Again, as I indicated, all the restaurants, all the businesses, including the non-essential retail businesses that now are able to provide curbside pickup and delivery, are listed on there. Working in partnership with some community organizations, we have included a page where people can purchase gift cards from local businesses. So that's a nice feature that is available. One thing that we do want to stress is social distancing doesn't have to mean social isolation. And so we are working regularly just to reinforce to people that how they can still connect with individuals without necessarily seeing them. And so that's important. So we've got health information, wellness information in there. Unfortunately, during this time, we are seeing an increased number of crisis calls. And so we are sharing information about crisis support systems that are available to individuals. So if they or any of their loved ones or friends need that 24-hour confidential support, links are available on our website. We also have resources for domestic violence, as we are seeing a number of calls about domestic violence resources that are needed. And then the Department of Health and Human Services and the Park District has a great Move Your Way campaign where they're encouraging people to get exercise and how to go about doing that in a safe way, again, making sure that there's physical distancing measures put in place. So this is just a snapshot. That last bullet point about graphics, the state of Illinois, city of Chicago, Lake County and others have different graphics where kids can color them, people can post them. Businesses, they can get information to post the front of businesses to relay information for their customers as well. So there's a whole section on that site. So just some information about business resources, and there's an entire section dedicated for businesses that we encourage individuals to take a look at. We have a separate e-newsletter that goes directly to businesses. And so all of our businesses should be signed up for that. And if someone is watching and they're not getting it, if they could just let us know and we'll make sure to get that information to them. One of the most popular programs that we are promoting is the Paycheck Protection Program, or PPP. This is a program that offers low interest loans that may be 100% forgiven, as well as grant opportunities for individuals who are self-employed, small businesses, independent contractors, and others. There's the small business grants. And so if individuals have 2 to 50 employees, they can receive grants in the amount of $10,000 to just help them with their day-to-day business as a result of the COVID outbreak. So significant amount of loan information as well as grant information. And then we're going to be rolling out a small business relief fund that we've been working on with Highland Park High School. We'll be able to offer grants to Highland Park small businesses that have been impacted by the coronavirus as well. And again, our business section on our website is updated daily as well. So we have received a number of questions about special events. And this is usually such a special time of the year because everyone is putting all their special events and plans in place. And we usually have over 100 special event permit applications that we process each year. But this is typically what our special events look like. It's just a great opportunity for the community to come together. And so in light of the pandemic and the significant health concerns with gathering, Governor Pritzker did advise last month that summer festival organizers canceled their events out of an abundance of caution. And so we at the City of Highland Park, we went ahead and early on we canceled the Memorial Day event that was scheduled for the end of May. Coordinating with the Park District, we have canceled our Independence Day celebration. Now, that doesn't mean that we're not going to do anything. So we are going to be exploring opportunities where people can still celebrate Independence Day, but we're not going to be gathering together. And so, so further information will be coming about what type of family celebrations and things that we can do as a community while we are still under this order. We are working with the applicant for the farmers market, and they are putting together a proposal to coordinate the farmers market in the Ravinia Business District based on very specific parameters that call for the booths to be spaced out. We're taking a look at the layout, the traffic flow, other farmers markets that we have looked at, as well as the applicant, have implemented no-touch payments, certainly no food demonstrations on site, no sampling, making sure that people are wearing gloves and face coverings. And so we are reviewing that application, and we will certainly share that with the City Council once we get the complete application as well as the staff review. Food Truck Thursdays is certainly a special event that we've coordinated in the past, and that's going to be reevaluated in the future. And we are in regular communication with special event coordinators. So although these special events this summer and fall are looking to be canceled, we are looking at other opportunities with them and brainstorming how they could still carry out some type of festivities without having that public gathering. And then last week, certainly as the council is well aware, Governor Pritzker did roll out the Restore Illinois plan. This 5-phased plan to reopen our state was based on health metrics with specific information for businesses, education, recreation activities. So this information is on our website, and it had very specific measures of how to move from one phase to another. And so certainly we're in phase 2 right now. So we do have a slow and really careful approach to reopening to try to limit and prohibit a surge from occurring in the future. So this plan is on our website. And then more specifically, Mayor, as you had indicated, the plan is broken down by regions. And so the Northeast region is the part that we're in. And this is kind of a dashboard of the information that is going to be regularly monitored to determine whether or not a region can move into that next phase. So they're looking at the positivity cases, they're looking at ICU bed availability, ventilators, as well as other factors. So we're going to continue to have links to this information on our website and be communicating it as well. And then finally, just a couple of highlights of other city initiatives. We are in the process right now of conducting a comprehensive budget assessment for fiscal year 20, taking a look at how this pandemic has impacted the city's budget. From a tax perspective, we as a city have done very well over the years to make sure that we get our revenue from a variety of different ways. So we diversify our revenue, so we're not really reliant on any one source. So for example, in terms of property taxes, we've been doing a great job to keep our property taxes as low as possible. And so if an individual looks at a property tax bill, you'll see that out of the 11 taxing bodies, the City of Highland Park being one of them, we make up about 7% of the total bill. And so we've worked hard to keep that tax amount as low as possible. We do get our revenue from other sources, such as sales tax, and certainly with this pandemic has had a significant impact on those types of revenue streams. So we are we're planning a finance report at the next meeting, so we'll share further information about that. And we are in the process of developing our fiscal year 2021 budget, which certainly this pandemic is going to have an impact as well on our 21 revenues as well as associated expenditures. So further information will be coming about that. We are planning a virtual town hall on May 20th at 7 p.m. Our website lists the call-in number. This is an opportunity for elected officials and staff from all the units of government serving Highland Park to be at this town hall. So we'll each give a very short report pertaining to our respective jurisdictions. And then we will open up the meeting to questions and comments from the public as well. We are in the process right now of doing a business survey to find out from our local businesses what type of resources, recommendations do they have as they take a look at different business strategies as part of this reopening plan whenever the reopening takes place in the future. So we're getting ahead of that and want to make sure that work very closely with them as they're looking at their different business structures. More locally, we are putting together plans for our city facilities and what does it look like when we reopen our city facilities. So again, looking at different staffing models just to make sure that people are still staying physically separated, distant from each other. How can we best serve the public? Again, just making sure that we're keeping the public safe as well as us safe. And then overall, we're just going to continue to provide communication to the public via various modalities. And we welcome the public's feedback because I think really that's what continues to make us an exceptional community is just all the ideas of everyone coming together to support each other. And this lists, again, just highlights of information and resources where people can either call, email, or further get information. If people remember anything, they can go to the city's website, and we have links to all of our government pages as well. That Lake County testing site is what Mark had referenced earlier in the meeting earlier. So this is the location set in Waukegan right now. They're doing 750 tests a day, which is significant. It was up from 500. So it's a free test, whether individuals are symptomatic or asymptomatic. They're not asking any immigration questions. And so really it's just a great opportunity for someone to go get tested, which is encouraged if certainly they have symptoms or they've been in contact with someone who they believe has symptoms or is positive. And I will end with the John Lennon quote, which says, "Everything will be okay in the end. And if it's not okay, it is not the end." So I am confident that we are continue to rise above this challenge. We will get through this really better than we were before. And it's because of these individuals on this call and because of our entire community really working together.
Thank you, Geeta. Thanks for a very comprehensive update and for all of your hard work. Councilwoman Noble has her hand up, but I have a couple of things and Councilwoman Stone as well. Just wanted to add a couple of things as far as Memorial Day. I believe we put out in one of our e-newsletters, and we should have it up on the website, a suggested list of about 10 different ways that people can recognize and commemorate our nation's fallen. We are not meeting until after Memorial Day again, so I don't want people to think that those are not available now. They are. Both in terms of reading the poem that we read every year in Flanders Field, saying the Pledge of Allegiance, writing a story or a remembrance of somebody special in your family or somebody that you knew who was important to you. So I urge people to take a look at the city website, and maybe we can move that up to the front or put it back up on social media as we get closer to Memorial Day. I know Councilman Noble also had asked about a business town hall. Is that why you had your hand up? Okay, so if you want to talk about those details, that would be great.
Yeah.
My question was simply that when you talked about all the initiatives that we are also having the business town hall and it's open to the public. And I wanted you to just answer for anyone who's tuning in, we're getting ideas daily of like, I must get an email an hour of like, yeah, close the streets or, open a store or put a tent out or whatever it is. Can you address where people should be sending all of those great ideas, that all ideas are good ideas and when we're having the town hall?
Yes, excellent. I'm happy to. So the virtual town hall for business is going to be held on Friday, May 22nd at 8 a.m. And so if you go to our website, you can find out the call-in number and the contact there. And again, this is, it's targeted towards businesses, but certainly anyone is welcome to attend. We right now also have a representative from the Department Department of Commerce and Economic Opportunity that's planned to be one of our panel members. And so we're putting that together. If individuals do have recommendations, whether you're a business or whether you're a resident, you can contact our business development manager, Carolyn Hirsch. You can email her or call her, or you're welcome to email the general city number, and that email address is cityhp@cityhpil.com. And we are collecting everyone's recommendations. We're evaluating them, and then we will put together information that we will promote as well as post on our website.
Great, thank you. Councilwoman Stone, and then Councilman Holloman, did you have your hand up as well?
No, I did not.
Okay, Councilwoman Stone.
Thank you. I just have a one clarification, either for Gita or for the mayor, regarding face coverings. My understanding is that those are required of, basically, if you go out and you're going inside any place that's not your home, you should be wearing a face mask. Is that correct? I was in a business today. I stopped to pick something up, and none of the employees were wearing face coverings of any sort. So I just wanted to get some clarification before I call them and talk to them about what they
So
should.
the state mandated face covering face mask order requires that people working in or visiting an essential business, or those who are out in public and unable to socially distance, need to have a face covering on. And I've received several emails and calls from people who are just incredibly frustrated, whether it's employees who aren't wearing the face coverings, or they've literally spoken to other customers and are kind of given an excuse of, oh, I forgot it, or oh, it fell off, or whatever the case may be. But I think it's important for these entities to recognize that it is under the law in Illinois a requirement that they are wearing face masks. So
Mayor,
yeah. Go ahead, Corporation
if I may
Counsel.
just clarify it, and just so that it's very clear. Councilman Stone, you said anytime you leave your home and go anywhere inside, it's not anywhere. It's just, as the mayor said, an essential business, and then only an essential business that is open to the public. Certain categories of services have been declared essential businesses. They may be in offices. It's the state order and the city order does not cover wearing of face coverings in those situations.
So what about other shops that may be open for pickup? Does that?
Yes, those are open to the public, and those would require face coverings.
Okay, and what should people do if they encounter this?
So if people are comfortable talking to the business manager or business owner, that way they can address it right away. They know which individual was not wearing a face covering, particularly if it's an employee. Or if they're not comfortable doing that, they're welcome to contact, again, business development office or their city manager's office, and our business development office is following up with all those businesses. If it's somewhere like at a like in Port Clinton, people are there congregating. It's hard to maintain physical distancing, but there are people around. And let's say they're waiting in line to get in and, pick up their ice cream or something like that. Individuals in those areas where the 6-foot separation can't be maintained and there should be wearing a face covering, they're welcome to contact the non-emergency police number in those cases.
Thanks.
Councilman Holloman.
Yeah, I want to urge just a couple notes here. So Steve, the requirement is when physical distancing is not possible, correct? Or is that just the state's? Is there a difference between ours and the state requirement?
Yeah, ours is a little stricter than the state's. We include some businesses that are not covered by the state, but where physical distancing is not
possible.
Outside.
I would just,
outside.
I just want, I want to get into the distinction that I made in response to Councilman Stone. It's not any indoor location. It's just those essential businesses that are open to the public or outside.
But to clarify, you need to wear a face covering inside those businesses, regardless of the social distancing. The social distancing exemption for the face coverings is only outside. It's not inside these essential businesses. You can't go into a store, if I understand it correctly.
Mayor,
that's not
that is
correct.
absolutely correct.
Okay, so
That is-
100%, you have to wear a face mask in an essential business, no matter what.
Yes,
Okay.
Even if you're the only
Again,
person
hold
in
on,
there.
hold on.
Yeah,
And
when physical distancing is
not
possible.
any essential business, an essential business, but like accounting firms are essential businesses under the state law. If an accounting firm does not have an interaction with the public, those accountants that are sitting in their private office do not have to wear a face covering. I just want to make that clear. And we have accounting offices or real estate brokerage offices in Highland Park. Both of those are classified as essential businesses. It's essential businesses that are open to the public that require face coverings at all times when anyone's inside those essential businesses.
Okay, and then my one comment is in terms of enforcement. Just want to urge some caution here. We've seen some horrifying actions by people who have taken the law into their own hands and have been retaliated against for speaking out. So if there is an issue, I would urge people to, if you can speak to the manager of the establishment, great. But if I would caution against talking directly to any employee at an establishment, the same way you wouldn't speak to your a child without going to a parent first, because it puts everybody in a very difficult and awkward position, and we don't know how people will react. So I think reaching out to the manager of an establishment if it's really making you uncomfortable, but then following up with the city manager's office, and then as a last resort, reaching out to the police, utilizing those resources wisely, I think is important, because we don't want to see a situation where somebody's harmed or people get, it's a very divisive issue right now, and I just think we need to be conscious of that.
Thank you. Councilman Bloomberg.
I just want to echo what Councilman Holloman said. The wearing of the face masks is certainly important, but confrontation is really not going to achieve what we want. Everybody's very frustrated. Everybody's trying to obey the restrictions, but as Councilman Holloman pointed out, the confrontational situation can develop very unexpectedly. And I absolutely encourage that if there's an issue, it be addressed to the store manager separate from the event itself. But there's the other problem of customers who may enter an establishment without face covering. Whose responsibility is that? And again, I would encourage that be addressed not to the customer who's walked in, if you're also a customer, but to the manager, to allow the manager to handle it in a more neutral and universal fashion.
That's correct, right?
Councilwoman Stone, did you have something you wanted to add?
I wanted to thank Councilman Holloman for bringing that up. In this particular case today, the business that I was in, it was the manager who was not wearing a face covering, so I didn't feel comfortable saying anything. In a previous case, I was in a business, an essential business, where the employees were not wearing face coverings. I just wanted to get out of there. So I dropped off what I needed to drop off. I left, and then I phoned the manager after I got home so that there wasn't a confrontation. So that's an option as well.
Great. Any other questions? Michelle?
I think the biggest aid to enforcement and something like that is to not frequent businesses where people aren't wearing masks, right? If you walk in and people aren't wearing the masks, you can certainly not go to the businesses. And I think that eventually that managers will get the message, right? That people aren't willing to go in there. So.
Okay. Any other questions on this topic? This has been a really good meeting in terms of information, and thank you everybody for pulling everything together and for your continued thoughtfulness as we try to protect our community's health. So that's it for the report of the mayor. I have no appointments. I have no proclamations. I have no other business. Our next item on the agenda is business from the public. This is for citizens wishing to be heard. And I'm curious to know if we have heard from the public either via email in advance of this meeting, during this meeting. I believe there's also an opportunity after this meeting.
Mayor, there is one email that we have received from David Meek as it pertains to the Cooper's subdivision.
And so that is an item on tonight's agenda. I can certainly pull that item from the omnibus consideration. Are there any other pieces of business from the public?
There is not, and I will check again at the end of the meeting as well.
Okay, so items 1 through 4 have been grouped together for omnibus consideration. Item 4 is the one which has, it sounds like input from the applicant's attorney, so we'll pull item 4. And I am seeking a motion to approve items 1 through 3.
So moved.
Any comments or questions on items 1 through 3? Hearing none, seeing none, will the clerk please call the vote?
Councilman Stolberg,
Aye.
Councilwoman Stone.
Aye.
Councilman Kaufman,
Aye.
Councilman Bloomberg,
Aye.
Councilman Noble,
Aye.
Councilman Hallman,
Aye.
Mayor Rotering.
Aye, 7 ayes and no nays. Items 1 through 3 have been approved. Item 4, resolution approving the preliminary and final plat of the Cooper's consolidation at 827 to 833 Pleasant Avenue. My understanding is that the letter from their attorney is specific to a question that is not under consideration under tonight's council action. So Corporation Counsel, does it make sense? We'll still hear the email and then go forth and take action accordingly?
That's right, Mayor. It's about a bonus FAR issue that is not a matter of your agenda tonight. You can listen to the letter and then you can proceed with your consideration of the matter.
Okay, thank you.
We're working through it.
Okay, thanks. So,
And can I
city
just add,
manager? Oh, go ahead.
sorry. So Mayor, we do have 2 callers on the line. I've unmuted both of them. Mr. Meek just wanted to make a comment as it pertains to that agenda item. Now, I did talk to him earlier and it was, we did have a conversation. He was interested in a matter as it pertained to a bonus FAR for this on behalf of his client. And we had indicated to him that it is a separate of this agenda item. We'll continue to work with him on that subject matter. If the consideration requires council approval, we'll certainly bring that to the city council for formal consideration. But that's being evaluated right now with our corporation council.
Right.
Okay.
Mayor, I'm actually surprised that the attorney wants to make a comment. This is not about the matter that's on tonight's agenda, but he's, of course, it's a public meeting. He's welcome to say what he wants. We had talked to him on Friday and thought that he understood that this was a separate matter, but I'll let Mr. Meek speak.
Hi, this is David Meek. Thank you. I'm sorry there's been confusion. I thought I made it clear in the email I sent. All I was notifying the city was that I was going to be calling in case there were questions on the plat itself, but was not intending to make any sort of statement about this. And I have spoken with both Gita and with Joel Fontaine today to tell them I did not intend to speak, but I was just going to call in case there were questions about the plat. So that's
Terrific.
all I have to say. Never
Okay.
intended to speak tonight.
Thank you. Are
And-
there any questions regarding item 4 as posted on tonight's agenda then? I don't see any. Okay. Any, I think then we just need to get a motion and a second on
Move
item
to
4.
approve. Move to approve item 4.
Second.
Okay. Will the clerk please call that vote?
Councilman Stolberg,
Aye.
Councilwoman Stone.
Aye.
Councilman Kaufman,
Aye.
Councilman Bloomberg,
Aye.
Councilman Noble,
Aye.
Councilman Holloman,
Aye.
Mayor Rotering.
Aye, 7 ayes and no nays. Item 4 has been approved, and so we will wait to hear from Mr. Meek and the applicants regarding any further consideration on the related properties.
Thank you.
Thank you. And then do we have a question from the other caller? Do we know?
Nothing
I
further.
believe the other caller is my client, Noel Cooper, who just wanted to
Okay.
the matter tonight.
Well, glad you could join us. Thank you and
Thank you.
congratulations.
Appreciate it. Thank you.
Terrific. So in terms of other business, I think we've covered a lot of other business in advance of this portion of the agenda. Do we have any other business? No. Okay. Any further business from the city council? You all look healthy. I wish you continued good health. Any business from city staff?
Nothing further, Mayor.
Okay. Then following this city council meeting, we will then go into our committee of the whole meeting, as I understand it. So, and in terms of this meeting, Corporation Council, we do need a motion to adjourn, correct?
That's right. And remember, you're staying on the same video
Zoom, right.
committee of the whole. So don't anyone hang up yet.
Don't go anywhere. But we are adjourning the official city council portion of this meeting. Is there a motion to adjourn?
So moved.
Is there a
Second.
second? Thank you. All those in favor say aye.
Aye.
Aye. Okay, the council meeting is adjourned. And I for the city of Highland Park, Illinois on May 11th, 2020. Will the clerk please call the roll?
Councilman Stolberg,
Here.
Councilwoman Stone.
Here.
Councilman Kaufman,
Here.
Councilman Bloomberg,
Here.
Councilman Noble,
Here.
Councilman Holloman.
Here.
Mayor Rotary.
Here, we have a quorum. May I have a motion to approve the minutes of the last meeting of the committee of the whole?
So moved.
Second.
All those in favor say aye,
Aye.
Aye.
and the minutes are approved. I am lacking my agenda, so I'm kind of winging it at this point. Gita, do you want to?
Mayor, you may want to consider a motion at this time to, are we doing the closed session now, Gita?
Yes.
Mayor,
Oh,
you
okay.
want to consider a motion to adjourn to closed session to discuss pending or probable litigation.
All right, I'm not adjourning, I'm recessing, aren't I?
You're adjourning to closed session.
Okay,
You will come back to this meeting and adjourn the committee of the whole.
gotcha. All righty. So seeking a motion to adjourn to closed session for matters regarding pending or potential litigation. Oh,
Mayor, I think there's
we have people
also
with their hands
approval
up.
of closed session minutes.
What?
Approval of closed session minutes also.
We have
Not
to be
until we
in
get in-
closed
oh,
session to
okay.
approve
Right.
those minutes. We're not
Right.
in closed session, so we need to get into closed
Yeah.
session
But,
and then we approve those minutes.
but what I think Councilman Stone is saying, that's another basis for the closed session.
Okay, thank you. So pending or potential litigation as well as approval of closed session minutes. Thank you. Councilman Stolberg.
Just to clarify, Mayor, so we're going to relaunch or log into the closed session Zoom link. And then
Yes.
how do we get back to this one? We just
don't-
relog in?
Reload.
You won't
this one.
have to.
Only the
just-
mayor's going to go in and
I just
staff.
need to come back.
Perfect. Just wanted to make sure we didn't lose each other in this high technology world.
Appreciate it. Thank you.
Thank you.
We do love to follow the rules. All right, so is there a motion to adjourn this open portion of the committee of the whole?
Yes. I'm moving that we go into closed session
Right.
to approve the closed session minutes and to discuss probable or imminent litigation pursuant to 5 ILCS section 120/2C 21 and 11 respectively.
I'll
Thank
second.
you for saving me from myself. Go ahead.
No problem.
And that was a second from Councilwoman Stone?
It was.
Okay, will the clerk please call that vote?
Councilman Stolberg,
Aye.
Councilwoman Stone,
Aye.
Councilman Kaufman,
Aye.
Councilman Bloomberg,
Aye.
Councilman Noble,
Aye.
Councilman Holloman,
Bye.
Mayor Rotary.
Aye. Okay, so we will be adjourning to closed session. So leave this meeting and I will see you in the next meeting.
Okay. And Rob, I've got you as host, right? Okay, perfect.
Direction from the City Council of Highland Park, Illinois. I have been directed to adjourn this committee of the whole. And I wish you all a lovely evening. Is there anything else you need to hear from me?
No, nothing further, Mayor.
All righty. Be well, and thanks everybody for all your hard work. Take care. The meeting is adjourned.